Hi, everyone, and welcome to the Heart of Innovation, where this month, are spotlighting healthcare professionals making extraordinary differences in the lives of those with peripheral artery disease, which is poor circulation in mainly the legs, which impacts 1 in 5 people over the age of 60. Today is really special as we are presenting America's PAD Podiatrist of the Year Award to Dr. Sara Rose-Sauld of Massachusetts General Hospital in Boston. This recognition comes directly from the patients themselves who've experienced firsthand her life-changing approach to care. Dr. Rose stands out for her exceptional talent in healing complex wounds and preventing amputations that others might have deemed impossible. Patients consistently highlight her compassionate care that addresses both physical and emotional aspects of PAD. Beyond her skill set, Dr. Rose's accessibility during urgent situations through patient education and tireless advocacy when coordinating with specialists have transformed countless lives and saved so many limbs. So I'm excited to introduce her to you in just a moment to show you more of why she has earned this prestigious honor. But first, Dr. John, guess what? We have a surprise co-host today. Can you guess who?
Well, I would have to imagine. Well, I kind of know already, but I know I also know you, Kimberly, and I know that you have the proclivity of kind of coupling people, and so I suspect we're going to have one of our favorite podiatrists on, who it sounds like is vacationing or trying to vacation. So we're taking a little
Thank
bit of
you.
chunk out of his time. So we most certainly appreciate him being here.
Yeah, world-renowned podiatrist and our 2024 Patient Champion of the Year. It's Dr. David Alper who's here, who's I'm so happy is on my board of directors as well.
Oh, good
Yes.
afternoon, everybody. And believe me, it is an honor to be here with my colleague, Dr. Rose. I will thank my lovely wife and family for slicing a little bit of time out, but couldn't miss this. Wanted to make sure that I could give her a public handshake and congratulations.
You were saying right before we got on here that Dr. Rose is literally the creme de la creme of limb salvage. Would you mind before we introduce her so we can make her really blush before we bring her on camera here? Share some words.
Well, I will tell you that Sara represents the best of my profession. Podiatrists throughout the country do whatever they can to try to help their patients, but Sara takes it 3 or 4 steps farther. She takes it personally when a limb is at risk, and she makes sure that she gets to know the patient. And this is why I think they reached out to honor her, because at the end of the day, they feel that they truly have not just a doctor, but an advocate. One thing that you didn't mention that I've been privileged is to listen to Sara speak, because when she's not in the operating room, she lectures throughout the country on exactly what she's doing and exactly the approach that she has. And the other thing, too, is that the relationship she has with Dr. Dua at Mass General is so unique. Fortunately, it's becoming less unique as everyone is realizing that it does take a village to save limbs. But Sara was right out in front with working with other physicians, other specialties, to really make sure that the patient got everything they needed, right down to the physical therapist to help teaching them walk again. It's really a very special person that we have here. And I will say that as a podiatrist, I am tremendously proud to call her colleague and friend.
Thank
It's
you.
so fantastic. I think we should bring Dr. Rose on. And congratulations, literally, thank you from the bottom of my heart and on behalf of all of our patients for all you do to save life and limb, Sara.
Thank you. And thank you so much for having me and for this honor. It's much appreciated. Sometimes we're in the office kind of doing the little things and don't realize when people really stop and notice. So thank you guys so much.
And we want to dive into your career, but we kick off every show as if you're not the ultimate inspiration. But we do have Dr. John's moment of inspiration to get us started and get us underway.
Dr. John Phillips' spectacular vascular moment of inspiration.
Uh, you know, uh, So before I get into that, Kimberly, each time we have the show, and it's always the promo starts and the Emmy Award winning, it always just brings a smile to my face because I love the fact that you're so polished and buttoned up. You do a wonderful introduction. I kind of come on and, I guess I'm color commentary to some degree and maybe a little bit of humor. But at any rate, so today I was, we kind of been talking about obviously Sarah's a patient advocate. We're all kind of patient advocates, but at the end of the day, the patient kind of has to have some culpability and responsibility. So I was looking for a quote about that a little bit. And, we all know Hippocrates, kind of the father of medicine. And he's quoted as saying something along these lines. And it takes a second to digest this, so I'll go slowly. But he said it's more important to know what sort of person has a disease than to know what sort of disease a person has. And I think that's profound in the sense that we sometimes don't give the patients who have this PAD and CLTI enough credit to understanding what's going on. And I think I've been trying to empower them a little bit more, so to kind of open the book for them, for their knowledge, so they get smarter about it, and then they understand the gravity of what's going on. And I think that just leads to a better relationship, and then ultimately probably more success, both with just wound healing and longevity and decreasing cardiovascular events and things of that nature. So again, I try to focus on the sort of the person who has the disease, not the disease that has the person. So nonetheless, happy to have Sara on the show. Super stoked to talk about her because I'm curious as how you got into this role, Sara, because there's a lot of podiatrists out there that don't necessarily get into kind of the wound healing and the CLTI aspect of things. So looking forward to the show, and super glad we've got David on as well.
Yeah, it's interesting because one of the reasons and how the patients talk about Dr. Rose, your quote literally nails her to a T. Hands down, right, Dr. Rose? I mean, I saw you nodding as he was speaking.
Absolutely. And what I was thinking actually was I can literally picture myself in the office talking to a patient, and some of the research we've done, patients are incredibly interested in. So particularly the work I've done with the Night to Dua and a lot of the other vascular group on deep venous arterialization. And you tell patients about, oh, this is the studies, this is what's coming out. And they actually are really interested. And I think that makes them want to participate in their care more. So kind of really empowering them through education. And even when they're involved in a clinical trial, they think it's the coolest thing. They want to learn more about it. Even we see a lot of different people. We see homeless people. We see very well educated Harvard staff. We see we've had celebrities that we've treated, and all of them, it doesn't matter. They all have some interest when you're like, hey, look at this is the latest data we've come up with. This is what we know, and that really empowers them to want to participate in their care even more.
And coming up right here on The Heart of Innovation, we're going to have more with Dr. Rose. Yes, we're going to explore her entire career, find out what drove her to limb salvage with all the aspects of podiatry care she could have focused upon, why saving limbs from amputation. We'll hear more from Dr. Rose coming up next, right here on The Heart of Innovation. Don't go away.
How many procedures are you willing to go through? Is it worth going through that many, or would you rather just...
That's funny. Was it worth it? Oh yeah, I have my leg, man.
Amputation should absolutely, positively, 100% never be a first-line treatment.
What an incredible operation, what an incredible lab you have here.
Without a doubt, we're underdiagnosing peripheral arterial disease. It has not gotten the attention that it should because it is a killing disease, it is a disabling disease, and most importantly, it's a disease that we now have great treatments for.
Okay, let's go to the next one.
They were going to amputate it, and I needed to consult with my family. Did I want it off here or here? You're just shocked. It's scary. I don't even know how to explain it. You're 42 years old.
We're waiting till people are at the end of the spectrum and almost beyond hope. There is good care available here. Closed minds are what we have to get rid of.
Welcome back, everybody, and thanks for hanging out with us today. We are privileged to have two famous podiatrists joining us, Doctors Rose and Alper. So, guys, let's talk. And I want to hear from Sara first, and then David is kind of the elder statesman. What drives somebody to get into wound care, particularly the complex wound care that we all have become a part of, folks that have chronic limb-threatening ischemia and are often at risk for major amputation? I mean, it takes a special person, right? Because these folks are very sick. They've got a lot of comorbidities going on. We've mentioned it. It truly takes a village to take care of these folks. And the two of you are kind of the quarterbacks, I think, of the care of those patients, which ultimately leads to their success. So, Sara, how did you get into this field?
So I'll have to say, I did not go into podiatry thinking this is what I was going to do. I went into podiatry thinking I was going to treat kids and sports, and everything was going to be cute. And then, I actually started doing it. And what I found was when you treat these patients, it's actually extremely rewarding as a clinician, to make a significant difference in a life. And it's actually hard to both treat, there's big things and small things in any like field of medicine, right? So podiatrists can treat toenail fungus, and we can treat legs that are rotting off, essentially. And the patient that I'm actually saving their foot and saving their limb, potentially saving their life, I found that a lot more rewarding than making someone's foot look a little cuter, a bunion a little straighter, or something like that. And so I did a lot of training in limb salvage when I was in residency, in my surgical residency in Florida. And then when I came to Mass General, there was a huge need for limb salvage that I had the unique opportunity to fill. And then I also had the unique opportunity to work with some really great vascular surgeons and interventionalists. So that kind of like makes this whole thing work when we work in a multidisciplinary team. So I kind of found my way into it, but I found it to be very rewarding for myself and for the patients as well.
Sara, you're being a little bit modest as far as what you did when you went up Mass General, because Mass General was not podiatry friendly, and for years and years and years, podiatrists were not even able to get on staff. So, Sara, in addition to going there, what kind of challenges did you face to knock down the walls and really get recognized as a valuable part of the team?
So, what I did was just make a whole bunch of friends, to be honest, because, you say they weren't podiatry friendly, and in a way, yes, but there was a huge need, a huge amount of people in the hospital that may have not been in my department or in other departments that saw the need for it. And so I just became friends with those people. Actually, how I really got into it was when a night to do started around the same time as I started, and happened to be on call. She paged me and said, "Hey, can I help you out with? Can you see this patient? Do you think they need a below knee amputation or whatnot?" And I said, "No, they just need this procedure. They just need a right amputation." And she's like, "Oh, can you do it? I'm about to bring him to the operating room." And I was like, "Yeah, I'll go scrub with you." And actually, that's a lot of how our relationship got started. I just scrubbed into a surgery with her and helped prevent an amputation. And she's like, "This is awesome. I'll send you all my patients." And then from that became awareness from the other vascular surgeons, "Hey, if we're thinking about an amputation or not sure what to do, we'll just give Sara a call." They've actually been extremely friendly to me, mostly because there was such a need there. And so sometimes it's finding your people.
For me personally, as an interventionalist, there's such a symbiotic relationship. Because we keep saying this, but it truly does take a village to take care of these people. And no one person can do it themselves. And it is very helpful when there's a podiatrist. There's one that I work with, Ralph Napolitano, quite a bit, and we just saw a patient together. And I think that kind of shared decision-making in front of the patient means a lot to them. The patient then knows that there's multiple people on their side, and it leads to success. And I think, what you're doing at Mass General, what folks are doing at other limb salvage centers across the country is changing lives. And we talk about in the Save My Piggies movement, it's kind of like your limb, your life, your story. And to keep the limb on somebody saves their life. And that's huge. And obviously that's why, Sara, we have you on the show, because you're definitely making a difference.
Well, and let me jump in here now, John, a little bit. The reason I said that to Sara is because when I was training and when I actually the first 20 years of my practice, this was not even an option on the radar for a podiatrist. We just didn't do these things. And what we were is the gatekeepers. So we would see the disease, we would see the need, and we would have a panel that we would refer to. And I was a general podiatrist. I did, as Sara was indicating, a little bit of everything. So I treated kids, I did surgery, I senior citizens with toenails, the whole 9 yards. And
wait, David, real quick, what does a kid need a podiatrist for?
Oh, well, you start with the basics of warts, ingrown toenails, sprains and strains, but there's also gait issues. Kids that either pronate or supinate, you need to put little plates in their shoes. It's actually a wonderful part of the profession. And there are some people, here's a term for you, a podopediatrician, and they do nothing but treat kids. And it's a very wonderful specialty.
Really?
And they never pick up a scalpel, which is okay because not everybody should pick up a scalpel. But that's a conversation for another time. Yes, some of them
in Florida. Dr. Sutherland that I worked with, he treated all the kids with clubfoot in that area. So not always podiatrists are treating the clubfoot deformities, but sometimes they are.
It seems like such a fun thing, podopodiatry. Sara, any regrets?
Yeah, well, yes and no. So I actually, when I was looking to go to medical school and I was a senior at Northeastern, I wrote one of my senior papers on the Ponseti method of how to treat clubfoot, and that's kind of what got me interested in podiatry. Because then, I was doing all this research, and a lot of podiatrists are doing the Ponseti method, which is a casting method to treat clubfoot, where they don't need surgery a lot of times. So that is what got me interested. But I ended up, again, making a whole bunch of friends in the hospital. I'm good friends with Gleason Rebello, who's an orthopedic surgeon, who is a pediatric orthopedic surgeon. He does a lot of the lower extremity stuff. And so we also kind of refer patients back and forth with him. And so I do see kids. I'm the one and the only podiatrist in the area that does see kids as well. So I do still see some kids, but mostly for the ingrown toenails and the warts.
See, I mean, I'm really good at derailing a conversation. So I only got a minute.
No, that's fine.
We've got a minute left with you, David. Just some final thoughts, because I know you got to get back to your family.
Well, and I appreciate that. Again, I don't want to blow Sara's horn too loudly, but this really is not only the future, this is the presence of podiatry in general. You asked me how I got into it. I got tired of doing amputations. I got tired of not being able to do more. And so I actually shut down my surgical practice to focus completely on wounds for the last 7-8 years of my practice, because to me, there had to have been a better option for these patients. And so I started to develop relationships with the vascular surgeons, the interventionalists at my hospital, so that we really could save these limbs rather than, the big toe needs to come off, go see Dr. Alper. But my time is when podiatrists were just entering us. Sara is now the top of the food chain because she's getting her hands deep in. And there are absolutely other colleagues that do this as well. It's really kind of an explosion in our profession, which is why I mentioned Sara's lecturing, because she not only talks to people that peers, but she's inspiring the students as well to say, this is something that I could do. This is something that I could get into. And that's how it happened with me.
Thank you so much, Dr. David Alper, for taking time out and joining us, and to his wife, Pam, and his sidekick, Gizmo. We really appreciate you. Enjoy Sanibel. And coming up next right here on The Heart of Innovation, we're going to continue with Dr. Rose, hear more of her story and the impact that she is having not only in Boston, but across the nation and potentially across the globe. Next, right here on The Heart of Innovation on KDOW. Don't go away.
Your type of condition is called critical limb ischemia. It's the most advanced form of PAD, or peripheral arterial disease.
Every 4 minutes, there is an amputation in this country due to PAD and diabetes. We also know that 85% of these amputations are preventable with early intervention.
It's a flip of the coin. Patient prognosis is tied to whether or not they are referred to a true expert in the management of peripheral arterial disease.
Do you know if your physician is an experienced CLI operator?
When you're in the hospital dealing with doctors and stuff, you figure they know what they're talking about.
The skill level varies doctor from doctor and hospital to hospital.
Patients with limb threat are in constant fear. The depression that someone experiences after they lose a limb is equivalent to those of losing their spouse of 40 years.
I was stuck in a wheelchair close to 2 years and my husband had to quit work.
I didn't know what to do at this point because we had had nothing but infections and hospital stays and infections and hospital stays.
And they took one toe, another toe, and then it was another toe, and then half his foot before he was even diagnosed with PAD.
And all I heard was, "What are we doing here? Just cut it off." And I pulled the curtain back like, "Are you kidding me?"
Do you really want to go through all that?
That's crazy. That's insane. The protocol is to send them to amputation. Always, always, always get multiple opinions.
We do have options. We need to listen more to our patients.
If you're going to chop off their leg anyway, why not just let someone else try?
This is the progression. First comes the wounds, and then comes an amputation. And I wasn't going to accept that.
So that's what it's like to try to save a leg.
Welcome back, everybody. Thanks for hanging with us today. We are live on YouTube, and we're having a blast with Dr. Sara Rose. So, Sara, I think one of the things that draws people to our show is we try to make medical topics a little bit more kind of down to earth and humanize them, and we share stories about how we've impacted patients, etc. So I know you mentioned you're treating folks that have no means to folks that have all the means, and you've got to kind of create a link right with that patient, you have to have empathy and or just the ability to understand where they're coming from. So any particular patients that you can think of that kind of stick out in your mind with respect to somebody that you saw that initially probably felt like, man, I don't know that I can help this person, to wow, they really came around and we made a difference?
Yeah. So I can think of this one patient, and this will always stick in my mind. So this gentleman had a baloney amputation on one side when he came to me, and a very proximal foot amputation on the other foot. So he only had a little bit of his other foot left. And when he came to me, he had a wound on that other foot. He lived alone. He was a smoker. He had uncontrolled diabetes, and was he spoke really loud. And so he's one of those people, some people, instead of speaking, they yell. And so he was like 6'4" and a big guy. And so he kind of like freaked a lot of people out. He had kind of a loud demeanor, but overall kind of a teddy bear inside. And so we did all these things to heal up this wound, and it just wasn't healing. We decided he needed surgery. We were going to do a skin graft on him. And in pre-op, the nurse calls me and she's like, he's being so difficult. He's not letting us put an IV in. I don't know if we're going to be we might have to cancel the surgery. So I was like, hold on, I'll be there in a minute. I knew the guy. I knew how he was, and I knew he was scared. And that was the thing. He was scared that he was going to lose his other leg. And so I think that was his sort of, he was talking loud, and the nurses kind of get nervous because he was nervous and kind of projecting. And it's a teaching hospital, right? And so we have a lot of interns and residents, and sometimes there's like the new resident putting in an IV, the anesthesia resident, and so he knew it was a new little a baby doctor, so we call them sometimes. And he's telling him, you better not miss my vein. Why don't you do the butterfly, IV? And he's saying, if you miss my vein, I'm going to punch you. And so, then everyone walked out of the room like, we're not going to, obviously violence towards healthcare workers is not okay. And I just went in, talked to him. He was just freaking out because he was scared he was going to lose his other leg. And so what we ended up doing was I literally held his other hand half the reason because I was scared he was going to punch the person putting in the IV, but also because he was scared. And I sat there and I literally held this man's hand while he got the IV put in. And then we were able to proceed with the surgery, and we ended up healing up his foot. But had I not sat there holding this man's hand, I don't think he may not have another leg because he would have not gone into the operating room that day.
Yeah, because it's so easy. And what you just said there, I think, is very poignant because it's very easy in what we do that sometimes it's kind of an assembly line. And I say that with regard for the patient, obviously, but it's kind of like, okay, we've got a finite amount of time, we've got X number of spots, we got to move. And like you said, anybody else they could have just said, you know what, we're just not doing this. Sorry, buddy, you're done. And then next thing you know, he loses his leg. So we've all had those patients because you knew him and you knew him well enough that this is what was going on and he was projecting and things of that nature. But someone who didn't know him could have just said, yeah, all right, cancel, on to the next one.
Absolutely. And yeah, and I think that sometimes getting to know them, and then, sometimes you're in a big healthcare system and everyone's not going to know them. The staff in the operating room, they didn't know him. They never met him before.
Right.
And so, yeah. Absolutely.
And that's where, again, so much compassion and care. And I think that story just illustrates why you are the 2025 Podiatrist of the Year. Compassion is so key. And I love that you bring up the good point that these patients are really scared. And to come from a place of understanding and to say they're projecting because of this, they're acting this way because they're scared, and being able to address that fear, you can resolve so much within them and help expedite, a lot of these procedures. It's just that one action of understanding. And I think that's huge.
Absolutely. And education too. So coming to these people, a lot of times these patients, they're labeled non-compliant, and a lot of times they are. But sometimes there's a reason behind that, they're not elevating their leg. Maybe they don't have a place to elevate their leg at home. And so a lot of times, saying, well, why can't you do that, actually makes a difference, instead of being like, okay, you're a jerk, you're not doing what I say, and walk out of the room, which unfortunately happens.
We'll come up next right here on the Heart of Innovation. We're going to have more stories with Dr. Rose from Mass General in Boston, Massachusetts. So stay with us right here on KDOW, the Heart of Innovation. Don't go away.
When your sugar runs high, it's more than a sign. Diabetes creeping in, it's a dangerous line. Pre-diabetes too, don't think it's too light. It can lead to PATS, so start the fight. Sugar's sweet, but the cost is real. High blood sugar makes your arteries feel clogged. Slow flow, it's a ticking time bomb. Catch it early, stay strong, and keep your legs on. Sugar's not so sweet when your leg is in pain. Not controlling sugar is where peripheral artery disease sets in. Got sugar? Get checked. Don't wait too late. Save your legs, save your life. Take control of your fate. Leg pain, cold feet, neuropathy too. These are signs diabetes caught you. High sugar's the link where circulation and pain left untreated. Your leg might end inflamed.
We are continuing our conversation with Dr. Sara Rose. So Sara, we were kind of talking during the break about the quote one that got away. And I recently had a patient who, similar to the gentleman you had before, he had already lost his his left leg below the knee. And I had done several procedures to try to save the left leg. And it wasn't there. So we had to come to Jesus talk about, he needed an amputation. He was withering away and he was, in a lot of pain. And I saw him after the amputation and he was very grateful. I was a little bit of a kind of tail between my legs because I felt like, man, what could I have done something differently or whatnot? And it was just frustrating to me. But I do know that he and his wife appreciated, for whatever it's worth, that I was there for a very small part. Any case like that kind of sticks in your craw a little bit, or similar situation?
Yeah, I've had a few of it. Never feels good when you lose a leg, of kind of that bad feeling, or when I'm doing so I do a lot of wound care, and when what you're doing just doesn't work. So I had this patient. She was from Somalia. She had 5 kids, and they ranged from, I had been seeing her for about 5 years. And so by the end of when I was seeing her, the youngest ones were in high school, but I'd seen them kind of grow up. The kids were doing the wound care. She had a wound on her left foot. We ended up healing that up. took 3 years to heal it, and we healed it, and then we got a heel wound, which is sometimes the hardest wound to heal on the other foot. And we were doing all this stuff, and it wasn't working. She actually ended up in the hospital septic from the foot being infected. At which time, I said, look, you need to amputate your leg. And unfortunately, her and her husband would not consent to an amputation.
Really?
How
does that work?
That's why this one keeps me up at night, because we had so many talks, and we involved spiritual care because, there may have been some religious or cultural barriers. We had interpreters, we had nursing staff, and, from various backgrounds speak to her and her family, and they didn't consent to the amputation.
And they knew it was life-threatening.
They knew it was life-threatening, and then by the time they did consent, it was too late. And so, unfortunately, she passed away.
But it's amazing the extent to which you were trying to not just, it's not just about saving the limb, it's saving the life at that point. And we have patients that tell us all the time that they would rather die than have an amputation. And several of those patients that we've had that conversation with that have come to that moment, we've had those conversations where they come to terms with it, and, they wish they didn't have to have the amputation, but they're very fortunate and they feel so blessed to have their life, even still without their leg. So that would be heart-wrenching.
And, what happened was they actually did consent, but it was too late by the time they did. She had multi-organ failure at that point. And so it didn't happen overnight. She was in the hospital for 2.5 weeks. And so that was me talking to her, the family, the sons, because I knew their family very well. I knew the kids very well. Heartbreaking to see young kids there watching their mom.
Was it cultural at all, or just?
So that's what I actually didn't know, because maybe like on a personal level culturally, because I actually did involve. She was Muslim, and I involved a lot of other people. Maybe it was a cultural thing from everyone else. They didn't think it was more of like a personal kind of thing. Between her and her husband making those decisions. And so we got everybody involved. Luckily in our hospital, we have a spiritual care service or something like that. And they provided their services. That's the one. I mean, because it was about 3 weeks, and it was slow and gradual and honestly horrible to see. But
what finally made them come around? I mean, if they went before and then suddenly, what made them come around? Did you find that out?
So I think what happened was on the other side, they had been recommended an amputation, and she made it out of it. Like the other things were done, and she made it out of it and didn't need it. And so they're like, let's just wait. Meanwhile, I told them, like, guys, if there's anything we could do to save your life, and I made it like you told that other patient told you, I'm very clear. Like, I looked her in the eye and I said, with an interpreter, you will die if you don't get this. I said that when she got to the emergency room. And I think we talked to the people that end up choosing the amputation because they say, like, at last minute when that comes down to that choice. But then there is a small portion of people ultimately it's their choice, and if they didn't want to live that way, it's horrible to see. It's horrible to be involved with, but it was her choice. We even had psych involved to make sure this was she could make her own choices, and she absolutely could. And with her family, and when they did get the amputation, one pupil was fixed and dilated, and it was too late. And so I think I think they maybe had the thought process of waiting, and maybe all these people are lying to us. But unfortunately, it didn't work out that way.
We can see how much this patient still weighs on your heart. It means the world. I mean, it's incredible. You're such a wonderful human on this planet. We're going to hear more from you in just a moment. Everyone, stay with us for our final segment, final thoughts right here on the Heart of Innovation on KDOW. Don't go away.
I tell everyone the day I stop learning, I'll probably just quit my job because every day is a learning day, and every patient with PAD is a different. But honestly, since I'm treating a patient recently that I probably should have paid more attention to the patient. And one thing which also is unrecognized is internal iliac artery disease. And so this patient had claudication. I kind of listened to the patient, but I missed that the patient was having more buttock claudication, and I really thought it was coming from his aortic iliac disease, and actually it turned out to be more related to his internal iliac disease. And even though we helped the leg, but honestly, I think there's something which is undertreated, or the internal iliac disease, which supplies the pelvis, which could be related maybe to impotence, even though that's a different, there's a multi-factor problem. But I think internal iliac disease is an area that is under-recognized.
Thank you, everybody, for joining us. We are live on KDOW, and the curtain is about to be drawn on another show. We've only got a few minutes left. So, Sara, thanks for joining us. Any parting thoughts, any funny stories? In the last segment, it was a little heavy, and rightfully so. But we also, it's important to have fun with the patients, right? I was telling a story about one of my patients who told me I was asking him to quit smoking. He said, "Doc, I'm not a quitter." I said, "Okay, great." So
some things you do need to quit.
Yes, exactly. Anything?
It's funny though. I'm not a quitter.
Not a quitter.
So I've had some patients come in with some really good jokes of them, not tiptoeing around the subject or anything like that. But recently, and maybe this is a little bit of my dark humor here. I had a patient. And so sometimes what we do when they have necrotic toes is we don't amputate them and they come off on their own, and I don't do any surgery. And I had a patient tell me this happened, okay? And she really was wondering how you embalm a toe to use it for a necklace because she really wanted a cute Halloween necklace. And she wanted to use her toe to preserve it. She said it was sitting right there on her dresser. She has it saved, and she just needs to find the person that makes it into a necklace. So if anyone out there knows, I did not know at the time. But if you do see a necklace looking like that, it may be real, turns out.
Just in time for Halloween.
Yeah.
Wow, okay. That might be the story we release on Halloween. Holy cow. Oh my God.
She really wanted to, she looked me dead in the eye. It wasn't a joke either. And I laughed.
That's interesting.
Yeah.
So can you, real quick, we've got a minute left. The necrotic toe auto amputates.
Mm-hmm.
It's basically, just mummified tissue. I guess you could, I don't know, could you drill a little hole in it and make a necklace out of it?
Just crumble?
I don't know.
Well, I think she wanted to preserve it. And it's concerning that her necklace would crumble apart, right?
Yeah.
And so,
well, you could maybe put it in a little container, a little
or put it in some, I don't know, some shiny outside so it doesn't
locket. A 14-karat gold locket.
There you go.
Yeah, with a little clear window. Oh my God, I can't believe.
Yeah, like a little heart that you open up, and instead of a picture of your kids, it's a picture of your foot or your toe.
With a little toenail window, is our producer Josh says. So that could be definitely. But you got to have a little dark humor. It is really tough. Trying to save life and limb, and your heart is so in the right place. One of the most compassionate people in podiatry today. Congratulations, Dr. Sara Rose, America's top podiatrist of the year for 2025.
Do your legs hurt when you walk? Do you feel cramping or numbness that makes you stop and rest? This could be more than just getting older. It could be peripheral artery disease, also called PAD. PAD happens when arteries in your legs become clogged, limiting blood flow. And when blood can't flow, your health is at risk. PAD affects millions worldwide. If you have diabetes, high blood pressure, high cholesterol, or if you smoke, you're at higher risk. Symptoms may include leg pain when walking, slow healing wounds, or numbness in your feet. Some people don't notice symptoms at all until it's too late. PAD is serious. It can lead to amputations, heart attacks, and strokes. But the good news? PAD can be treated if caught early. This September, take a step for your health. Talk to your doctor. Ask about a simple PAD screening test. Protect your legs. Protect your life. Every step matters. Walk strong, live long. Get screened for PAD this September. For more information, visit padtest.org or call our LegSaver hotline, 1-833-PAD-LEGS.